Good day. This is Dan Bensky. I'm very happy to be here virtually uh, to be part of this amazing uh, transnational Congress. My kudos to the organizers who have done an amazing job despite uh, all the things that the world, virtual and real, has thrown at them. And I also want to tell them how much I appreciate having the opportunity to share some thoughts about palpation, which is very near and dear to my heart. So, what we'll be doing in this talk is first, I'll be talking about some background about our ideas about traditional East Asian medicine and how palpation can add to your practice and understanding of it. I think regardless of what you do. And the second part of the talk will be using some things from a style that Chip Chase and Margaret Dinkins and I have developed called engaging vitality, more as an example of what palpation can help us, how palpation can help us than anything else. Before we get started, I need a little bit of music to get myself in the mood, and I would encourage you to get up and jump around for about 15 seconds as we listen to it. That's one way to get the chi moving. I always like to start some of my talks with this music, not only because it gets my chi moving and less constrained, but because the first Europeans to hear this music were missionaries from England in the 19th century. And when they heard it, they wrote back to their parishioners that these primitive people have no sense of rhythm. And when they have ceremonies and rituals, they bang on drums and logs at random, just because the rhythms were too intricate for them to even appreciate as rhythms. And so whenever we talk about palpation, this reminds us not to let preconceived ideas get in the way of understanding our experiences, which is really important, particularly when we do palpation. So there are some TEM core concepts that I think are background to why I think palpation is important. One is that traditional East Asian medicine is a set of interrelated and overlapping systems. It's not just one system. And this is a feature, as they say, not a bug. It gives us the flexibility to try and appreciate people and their problems in the way that we can be of most help to them, rather than us trying to squeeze and fit them into some kind of Procrustean bed. As a correlate of this, there is never, ever only one way to do things in team. There's always different ways of doing things. And again, that's a feature that gives us, if one kind of thing isn't appropriate or doesn't seem to work for someone, then we have another way to go. A third of the core concepts is symptoms do not tell us where the problem is, nor where is best to treat. So symptoms are important. I believe when people come to us with some symptom or other problem like hypertension, our job is to help relieve those symptoms or treat that condition, but it doesn't tell us what to do. They just kind of tell us markers of whether what we and the patients are doing are helpful. And this was brought down to me very, very clearly when I started studying in East Asia in the 70s, where the medicine was at least as factionalized as it is today. And when people wanted to really disrespect someone else's teacher, they would say something like, oh, your teacher's one of those people that when the patient's head hurts, she treats the head, and where the feet hurt, she treats the feet. And this was really something that could get you into a physical fight. Again, it's not that you never treat the head when the head hurts, but you don't know. It doesn't. It's not something you have to decide. You have to do a little bit deeper digging. So this also gets us to the correlate that our medicine is a clinical medicine. So the focus is always on being helpful versus some kind of abstract correct symptom. So being right is being helpful. If you're not helpful, you're not right. And I think that keeps us very grounded and helps us not get all off in, making diagnoses that have no use. Acupuncture is a call and response form of treatment. Acupuncture is not sticking needles in people. Moxibustion is not burning moxa on people. It is using those tools to get a response from the body. And if you don't get a response, then the treatment is worthless. And so that's, I think, a really important thing to remember. And the last, I think, of these core concepts that I want to talk about today briefly is that this is a traditional medicine. All traditional medicines are based on experience. That is their core, and that's why, in general, people who've done it longer should be better. Experience comes from paying attention. And if you don't pay attention, it doesn't matter how many patients you've seen, you really don't have experience. So those are these kind of things, the overlapping systems, symptoms not telling us what to do, focused on being helpful, and this idea of call and response form of treatment. I think these are really core things about what make our medicine so fantastic. And because of that, doing palpation has some advantages, particularly for us. One is that it gives immediate feedback. So if the goal of the goal of acupuncture is get a response, then if you can get immediate feedback, that will tell you if your response is good or not. And I think this is incredibly useful. I'll talk about a little bit more as we go later. But to have a sense that, oh, that needle's in the right place, that needle's in the wrong place, is really helpful. So you don't have to wait until whatever, a week or a few days later to see if your treatment was helpful. You get immediate feedback. Palpation also very easily filters out patients' biases. Very commonly, people have a sense that they think they know what's going on. Very commonly, they're incorrect. Sometimes they're right, not necessarily. So if you do palpation to get the information directly from the body, then you can easily filter out the patient's biases. It works to less easily filter out our own biases, which is much more difficult. But I think everyone who does palpation always has the sensation that when palpation is really, really useful, when we really feel like the work we've done learning palpation has been worthwhile, it's when we feel things that we don't expect. And so to a degree, it can filter out some of our biases. Paying attention is important, as I mentioned before. It's pretty hard to do palpation and not pay attention to your hands. In part because if you do that, the patients will know right away. In part because we're primarily visual, maybe secondary auditory culture. So for us to pay attention to palpation means we need to kind of up the game in our brain a little bit, and that makes it easier to pay attention. And the last thing that I think is particularly something we're very aware of at the present time is that people like to be touched. If you have a gentle, caring touch with people, that will really make them feel more comfortable and can be therapeutic in its own right. So while palpation has all these advantages, this feedback, filtering out biases, and helping us pay attention, we always have to be modest because it has its own limitations. So when we don't want to get too carried away. So the next thing I want to talk about are some of the approaches to palpation in traditional East Asian medicine. And I think I would recommend, and again, my goal primarily today is to get all of you to add some more palpation to your practices. What works for you will depend on who you are, what your practice is like, etc. So, of course, we all know that all forms of traditional medicine in Japan, in fact, if they're acupuncture or Anmo or whatever, even if they're not too traditional, even if they're pretty biomedically based, they do a lot of palpation. And so you can study this in different ways in the West. I have a couple of people in the websites here. So if you're interested in Japanesey things is something that appeals to you, you're probably doing palpation already. But in case you're not, you can study that. Even in herbal medicine, the Kampo, which is the mainstream Japanese form of herbal medicine, uses abdominal medicine, which they call fukushin. So even if you have a primarily herbal practice, there are ways, in all ways of palpation, but particularly this abdominal diagnosis from Japan is very useful. From a more kind of mainstream Chinese medical perspective, there's an amazing person who unfortunately died a few years ago named Wang Zhuyi, who developed this thing called applied channel theory. The teachers are excellent, and if you do some kind of mainstream TCM, whatever that means, acupuncture, I think you learn from these people, you'll really make a huge jump. Again, not only in helping your patients directly, but in deepening your understanding of the medicine and deepening your ability to really grapple with the theory. So I can't recommend the applied channel theory people too highly. And then if your way you do acupuncture is more orthopedic, or that's the kind of people that you see, and you want some kind of mix of kind of biomedical range of motion or ideas about joints and other kinds of sports medicine problems, you can't do better than studying with Matt Callison, who I believe is also giving a talk later in the week. And this is sportsmedicineacupuncture.com. So again, if you're doing that kind of work, even if you do some of the basic orthopedic tests, you can really up your game and again understand the tissues better and the muscles better and the East Asian medicine aspects better if you study with Matt or again someone else who does something similar. So this is by no means exhaustive in any way, but I'm trying to show here that no matter your style, the way your mind works, the kind of practice you have, you can add palpation. And it's not necessary, but I think it will really improve your outcomes and improve your ability to understand the medicine. Sorry. So let's talk the rest of the time. I'm going to talk about engaging vitality, which is a personal thing. Again, it's a one way of synthesizing traditional East Asian medicine and osteopathy. Again, it's not the only way. It's just the way that I've been started doing this maybe over 30 years ago. Chip Chase was also involved in 25 years ago. We've had Marguerite Dinkins and Rayanne Anton, Felix de Haas, many, many people involved. So I'm just going to talk about this partly to share my enthusiasm for it, but more, I think, since this is what I do, it's easier for me to give this as an example of how doing palpation can positively impact your practice and your appreciation of our medicine. So first of all, it's very clear, I think, to anyone who does any kind of East Asian medicine or any kind of osteopathy, that each of these approaches inform and amplifies the other. Not only do they perhaps work complementarily, but I think each one kind of illuminates some of the issues in the others. And again, I think no matter what you kind of palpation you combine with East Asian medicine, that will probably be true. Osteopathy has this particular things about palpation, which I think come into when we use it as a synthesis with team. One is that osteopathy is primarily about motion. It's not that alignment and tissue tension and stuff is not important. It is, but the hallmark of osteopathic palpation and ideas is motion is primary. We have a tendency to try and feel what's there, not the organism's reaction to our touch, I think is very important. That's important when you do pulse diagnosis. If you keep your hands as relaxed as possible and use the deep muscles of your forearm versus the intrinsic muscles of your hand when you do pulse diagnosis, it's much easier to get a more nuanced appreciation of what's there. And besides paying attention to the passive motions, by which we mean the motions of structures when you move or when you breathe, osteopathy has a lot of interest in inherent motions. And these inherent motions, as we'll give one example in just a couple minutes, I think really dovetail well with with understanding East Asian medicine. So we also have some kind of postulates that come about from this kind of fusion that we've done. One is that proper treatment requires constant reevaluation. And that means that you have to kind of keep checking yourself as you go to see, using the feedback that you get from palpation and from other things, the tongue, the way the person looks, their shun, etc., to give you the best outcomes. So you can't just do a kind of set treatment and expect to get the best results. It's this kind of dance. You have an idea what you do, you start doing it, you see how the patient responds, that will change whether you're on the right track or not, etc. Also, I think this helps us pay attention in order to avoid relying on conventions. And I think while sometimes in the alternative world we talk about conventional medicine as being equal to biomedicine, I think that's a kind of an oversimplification. It is true that for most people who do biomedicine, if there's something that appears to be statistically true 70% of the time, that becomes the standard of care. And if you're a rather lazy conventional biomedical practitioner, that's what you'll do regardless of what the person presents with. But in East Asian medicine, we also have conventions. You have someone has low back pain, you have X points to do for that. Some people have certain horror diagnosis, you do X points to do that. All those things are conventional. And I think to us, they get in the way of really responding to the patient, seeing the patient who they are at that time, and getting the best results from them. So we have this posture that you want to avoid, you want to pay attention and avoid relying on conventions. The clearest example, which I think is true for almost everybody who uses palpation a lot, is the response of the body determines proper point location. So whether the response that you're looking for is a sense that you have of the chi arriving, or a sense that the patient has of this needle sensation, if that's what you're looking for, the needle insertion in the place that gives you that response is the proper point location, regardless of whether that's exactly what it says in the book. Another one of our postulates is that we are making this evaluation, we want it to be as accurate as possible, and that means to use multiple indicators. We don't just want to rely on the pulse or the tongue or any of the other things that we learn. We want to use as many of them as possible, because that will make it more likely that we're not missing something, or we're not seeing what we want to see, which is always an issue. And in general, we believe that less is more when engaging the body's own healing mechanisms. That it's not important to treat X number of needles, but if you can pay attention to this constant reevaluation and using these different indicators, you can learn to tell when the body's own healing mechanisms are optimally or very well engaged, and then you should leave it alone. You shouldn't just keep doing things. Otherwise, you will overtreat the patients, which I'll talk about again near the end of this talk. So let me give just a couple of examples. Again, these are not specifically limited to engaging vitality. I think most kinds of people who do palpation will have similar things, but I'm going to talk about it from this perspective. One is that the pathways of the channels and the locations of the points are things that you need to find. They're not things you need to look for based on a book. They can't be more fixed than the pathways of blood vessels or nerves. That means there's no structure in the human body. Again, you can look at your own hands, the veins on the back of your hands, to learn this. There's no structure that's really fixed. They all move around to some degree. The organs move around, the nerves move around, the blood vessels move around. We have this postulate that the channels are real. In part, we believe we can feel them very well. And so because they're real, they move around a bit. They don't go to flip the other side of the arm or something, but they do move around, and you have to find them. You can't decide, like they have done with the World Health Organization, by a committee to decide this is where this particular point is. That's wacky. That's like convening an international committee to decide where the ulnar nerve is. Can't do that. And so we'll see, I think we have seen, and I think, again, people do palpation, see that as part of the the diversity of East Asian medicine, when people say many different things about a certain aspect or a certain structure, it usually means that they're all true some of the time. So whether it's the location of lung 7, the people put it in different places, that probably means on some people at some time it's in one place, and at other times on other people it's in another place. So you need to engage, you need to find it. And again, point localization has a major impact on the body's response. If you don't put the needle in precisely the right place, you don't get the best response from the body. So that's one way in which so when you engage with palpation this way, you learn that the channels have a reality to them, that they're not just abstract concepts, they're not things on a grid, they're things that are real, and you have to engage with them precisely in order to get the best response. So that's one example. Another example, which is a little more limited to the cooperation or melding of osteopathy and team, is expanding our understanding by paying attention to some of the rhythms. So one rhythm I'm going to talk about here goes by different names in osteopathy, and there's, of course, just like in team, there's lots of controversy about things, but I'm going to call it, originally I was taught it's called the craniorhythmic impulse. I'll talk about a little more detail, but it's something that is a whole body phenomena that appears to be primarily generated in the central nervous system. And if you look at the osteopathic literature, it's very clear that how they describe it has a lot to do with some of the basic aspects of the yang aspects of the body. So we have rechristened this in our Engaging Vitality courses, or translated it as the yang rhythm. Again, it's a whole body phenomena that reflects local conditions, and then it becomes a palpatory referent for the normal qi or the upright qi, the zheng qi. And I think this is really important. If you have palpatory reference for different kinds of East Asian medical concepts, again, they become real, they're physical, they're not abstract ideas. And you can use these in both diagnosis and the evaluation of needling, which I will try to explain some examples here. So when it shows you where the qi is stagnant, and again, for those of you who were here last year, I gave a little talk about tong, the sense of things being open, connected, free-flowing. So where things aren't tong, the qi is stagnant. And you can use different ways of feeling the yang rhythm in different parts of the body to compare and contrast and see which area with the lack of flow has the biggest negative impact on the organism. Because given our other postulates of a call and response and the less is more, you want to start with that area. So it's a good marker for that. So if you focus on treating that, and again, you don't necessarily have to treat it with a needle locally. We have these things called channels and points you can use. You can figure out how to get the best release of that area. It's another way to appreciate the arrival of qi. Everyone who does those styles of acupuncture have their own ways. But one of the advantages of doing it with the yang rhythm is you can see if your qi arrival, the effect of your needle, is just locally or systemic. Because you can put your hand either far away, anywhere on the body, or maybe if the needle is distant to where this area of lack of flow is, you put your hand on the lack of flow, and you can see when the needle gets to the right spot, you'll feel the yang rhythm expand, become smoother, become easier, and so that's like as if that area has taken a breath, and that's a very, very good sign that you are getting a good response from the body. You can also use it in detecting overtreatment, which I mentioned before, and I'm going to talk about in a little more detail. But to me, overtreatment is a bad thing. At the very least, you make people tired or achy for no purpose. At the very worst, if you really push the body too much, again, if you are calling in a way that no longer gets a response, if it turns out you're not really listening to what's going on, you can make your treatments not very useful and undo actually a lot of good that you've done. When we look at overtreatment, though, I guess to be a little more complete, there are ways that are not necessarily palpatory to find them. Sometimes a patient will just tell you, I don't feel good. You can also look at their tongue. The tongue body will show teeth marks or will become scalloped. When people come in with a scalloped tongue, if you do acupuncture well, almost always those teeth marks will disappear. But if you keep treating them, then the teeth marks will come back even worse than before. And again, sometimes you have people, who have come in with no teeth marks, but when you overtreat them, they will develop teeth marks. So that's a very good sign that you've overtreated them. The pulse will become disorganized. And I think different people talk about this in different ways. To me, the simplest way is that you can't really describe the pulse. So the pulse may have been overly tight or wiry or overly deficient or sunken. And as you treat with acupuncture or moxibustion, it should become more normal. But if you overtreat it, it will become so disorganized. Again, the flow will become non-laminar that you won't be able to really use any of our normal terms to describe it. And that's the sense that you've overtreated the people and that they just won't be able to respond well. From the yang rhythm, which I mentioned before, I talked about this expansion and relaxation. What will happen if you overtreat them? That the liquid, which originally feels like it's going through, that these waves are going through water, will become thicker and more viscous. It will be something like motor oil or thick cream or even molasses. And the more thick it becomes, the more severe the signs of overtreatment will be. And the last thing I'm going to mention, we didn't talk about, but there's another thing we call manual thermal diagnosis or evaluation, also from Jean-Pierre Borel, the very famous and well-respected French osteopath, and that thermal layer will thin. So we can check the burners very quickly and see if they have normal thickness, if the thermal layer is normally thick. Normally when there's an area that's not working well, it's thin. When you do acupuncture, it will thicken up, and if you overdo it, you will end up becoming thinner again. And the last ones, we also teach people to feel the channels. Dr. Wang, the applied channel theory, also noticed that the channels become confused. They will buzz. So all of these are signs that you've overtreated the person. You're going to have not as good results. Normally, if you're paying attention to this and you stop what you're doing as soon as you start to feel these, then no harm done. So I'd like to finish up by kind of recapping that palpation equals engagement. This direct sensation of the traditional East Asian medical concepts, like the Zheng Qi, like the channels, make them more real. And when they're more real, we can deal with them in a real way. We don't have to depend on conventions or abstract concepts. We believe very clearly that the organs are also very palpable. They have a very direct connection, by and large, to the organs in biomedicine. If you want to feel if someone has liver qi constraint, you can feel their liver. And if the liver feels a certain way, you can rule out liver qi constraint as a major problem for them. So on all these ways, having these palpatory markers, these are really, really helpful. It aids in being critical of convention that I've mentioned and of yourself. It's very common for me anyway that I think I have an idea what's going on. As I pay attention primarily through palpation, I realize that my initial diagnosis was wrong. Sometimes completely wrong, sometimes just a little off, and I can course correct during the treatment by paying attention to this. I believe it aids in engaging with the tradition, because it's very common for people to have things they felt on palpation that they think, oh, I've discovered something new, and then realize later that it's been something that someone in the Song dynasty wrote about, or someone in the 15th century wrote about. Again, this one example is I've been fascinated by the triple burner from the first time I got engaged with East Asian medicine. And we have some very clear ideas about what it means. And again, after thinking we've used palpation to discover it, we read 15th century writers talking about exactly the same thing. So if it makes things more real, and tradition is about reality, not about abstract thoughts, then palpation helps you engage your tradition. It also gives you tools to approach patients in a more dynamic and fluid manner. We're not so rigid. We're not so we're not just kind of going through the motions. Palpation engages you with the patient, engages you with what's going on, makes you much more responsive to their real needs, and not what you might think they need or the patient might think they need, but what the body really does need. And again, as always, the response of the body determines how to proceed. This gives you a sense of freedom in some ways, and a sense to realize that the books and the theories are all indicators, they're all information for us, but the response of the body really determines what's real and what's not, and what we need to do. So I want to thank you again for your attention and time, and I hope that sooner rather than later we have a chance to get together and at least touch each other, if not palpate each other. Bye.